Well, welcome everyone to the latest episode of A Conversation with CAHC. I am Joel White, the president of CAHC, and want to remind everyone that May is Mental Health Awareness Month. The thing that I think about in this month is that there's about 1 in 5 Americans who are living with a mental illness. That's more than 59 million of our fellow Americans. And I think there's been great strides made to reduce stigma around mental illness and how people talk about it, how they communicate about their mental health issues, and how they seek treatment for it. And I also am excited that there appears to be innovative treatments and I would say an increasing awareness of the complexities of mental health and how that gets treated by science and medicine, and our understanding generally of how mental illness is an illness. And if it's an illness, we can treat it, and we can treat it and one day hopefully cure it. And that's exciting because I think the science and the medicine is catching up to our awareness and understanding. And I'm excited that today I'm joined by Gordon Lavigne. He is the CEO of SNPAA. Gordon and I are longtime friends. Say that I'm a proud board member of SNPAA. And so I want to welcome you, Gordon. Tell me a little bit about the work you're doing.
Thanks, Joel, for the opportunity to be here, and grateful for all the support and advocacy that you have brought to our organization and our community. SNPA is focused on removing barriers that stand in the way to treatment, survival, and recovery for people living with schizophrenia and psychosis. What that means on a daily basis for us is that we hear unimaginable stories, pain and suffering related to an illness that absolutely has treatments and approaches in order to allow people to recover. But what's standing in the way are a variety of barriers related to, like you mentioned, stigma, and actually goes broader in terms of discrimination. But people have real obstacles to finding access to treatment providers, clinicians, whether you're in a rural community or whether you're in the heart of Manhattan. Finding a provider who can provide an accurate diagnosis, actually providing a treatment option that works, and then from the perspective of someone living with schizophrenia, actually having a protocol, a treatment protocol that will work, that brings with it adherence, and ultimately all of the wraparound supports, psychosocial supports, peer-based supports, family supports, that whole journey from symptoms to treatment to adherence to actually having effective outcomes is a really long chain of activities. And along that chain, there are many breaking points. And every day, our organization is fielding phone calls from families, from those diagnosed, and from clinicians about what the realities of those chain connection points breaking means. And what it means for society is that we have too often overlooked those who have the most needs, whether they're underhoused or unhoused on the streets, whether they're in the criminal justice system, or whether they're doing everything right to be on a path toward effective treatment. There are so many things that our organization is trying to do, from elevating the realities of schizophrenia to advocating for better policies, better laws that have too often stood in the way in terms of limitations to the number of hospital beds, in terms of the ability to access treatments that work, because you have to go through a step-based therapy and actually fail different therapeutics before you can get access to something that actually works, to having a shortage of providers. These are all the things on a daily basis our organization is grappling with and advocating for, finding better solutions, because untreated schizophrenia and psychosis has a tremendous societal impact. Our organization estimates that the economic burden is well over $300 billion. And we think that with innovation in new treatment options, getting individuals access to treatments that work, will lower the societal impacts and actually bring about just an unbelievable sea change in how we view mental illness, broadly speaking, at a societal level. And if we don't do it, then what we're left with is a status quo in our country and in our society that has really terrible consequences for the individual directly diagnosed, for their family and all those who love that person, and then for the society at large, for all of the policy impacts that come into play with that.
Do you, Gordon, share my view that mental illness and specifically schizophrenia, which is a neurological disorder, right? Illness. If it's an illness, we can treat it and one day cure it. Do you share that perspective?
Our organization's vision is a cure for schizophrenia. And we know that the road from today to a cure is going to be very long and unpredictable. But our scientific advisors have weighed in that that's an appropriate vision. It's not going to come quickly or without tremendous investments in innovation and research to get to that point. But until there's a cure, recovery is possible. And the only way to get to recovery is to have innovative treatments that work, that allow adherence in terms of things like long-acting medications and things like clinicians who are accessible, in terms of things like a loving, supportive family, social support network, peer-based network. So we view it as until there's a cure, recovery is possible, but everything has to go right along that chain for the treatment process.
When I think about schizophrenia and psychosis specifically, it's not like a new surgical technique is developed that we're going to get a treatment and cure from, right? Like this is from drugs, right? Like innovative new products that come to market as a result of our scientific and medical understanding of the illness.
Absolutely right. The standard of care that organizations like the American Psychiatric Association and other similar entities globally, in order to treat schizophrenia effectively and underlying psychosis, there is a pretty comprehensive treatment protocol. And all of those things have to line up to create the adherence to the treatment protocol in order to have the outcome. So there's not a single solution that's going to work where someone wakes up one day, does one thing, and all the other issues disappear.
All right, so let's talk about the science for a minute. So like with any kind of brain illness, you've got a barrier around the brain called the blood-brain barrier, right? Like that helps protect the brain, but also keep it healthy and things like that. Very hard for large molecules to cross that barrier because you've got to get at a cellular level into the blood-brain barrier. Small molecules, much easier to cross that blood-brain barrier and then target the medicine to the specific point of, where it's going to be most effective.
I mean, so schizophrenia and other forms of severe mental illness, they do have a unique challenge that medications have to cross that blood-brain barrier. And in order to find appropriate brain receptors for targets for treatments, there's usually a risk-benefit profile, right? What is it that the individual is willing to tolerate? We've done some work through patient-focused drug development collaborations with the FDA on schizophrenia. And what we know is that the existing class of antipsychotic medications typically come with a variety of side effects. Some of those side effects are very manageable. Some of them require additional medications to offset, the side effect. And some of those come with realities that people are not comfortable with, weight gain and other potential physiological challenges. So finding the right balance in the treatment is really tricky. So we advocate for a variety of treatment approaches, therapeutic advances, innovation, because every person's brain acts differently to different therapeutic options, right? So we think that there needs to be a whole arsenal of approaches And typically nothing should stand in the way to people getting the access to the type of treatment that works for them. So policies and other regulatory barriers that stand in the way to treatment innovation is something that our organization is going to do everything we can to push back against.
So let's switch to policy then, because the Inflation Reduction Act has a program for HHS to negotiate lower drug prices for products that are selected. Starts out small, but gets big and probably gets most products in Medicare over time. But what it says about small molecules, which are typically pills, versus large molecules, which are typically biologics that are injected typically or infused in a physician office, is that we treat those differently, right? Like we're going to select pills for price controls. We're going to impose the price control on those products 9 years after they've been approved by the FDA. But for biologics, the large molecules, those will be price controlled after 13 years, so 4 years difference. And just to remind people, the small molecule products, the pills, are the ones that cross the blood-brain barrier. So that's where we need to see the innovation for mental illness, right? So if you've got a shorter runway for a pill than you do for a biologic, what we're seeing in the market now since the enactment of the Inflation Reduction Act is a lot less investment in small molecules and more investment in large molecules. Is that bad from a brain disease perspective and what you're hoping to advocate for?
So that 4-year difference, what does that mean in human terms for schizophrenia? So we know, and there's a lot of research that validates this, adherence to therapeutic plan is a challenge in our community. So formulations in things like a long-acting medication formulation are really important. If you don't have to take a pill twice a day, you can take it once every couple of weeks, then a stronger ability that the individual is going to stay on the treatment plan, right? So typically you don't go out of the gate with an approval in a long-acting formulation. That's not how it works. You do it after a couple years after a product is introduced on the market. So the incentive, the compressed number of years to potentially reformulate for an approval for a long-acting medication is next to zero, because you just don't have those additional years of patent protection in order to do it. So our population is uniquely disadvantaged, and some would even say discriminated against, because we know that long-acting formulations and other innovative approaches to treating schizophrenia will be potentially left on the sideline. And what that means is that societal impact is going to be even greater, not just an economic impact, but which is massive, right? I mentioned the $300 billion number approximately, but all of the other forms of societal implications, lack of employment, impact on the caregiver. What we know is that if your loved one is diagnosed with schizophrenia and you're doing everything right to get that person access to the right treatment, the toll it takes on the caregiver in terms of their lost productivity, their own wellness and well-being is greatly diminished, because all of their attention is focused on, we have some of the most amazing caregivers, and every caregiver is amazing in different ways, but for schizophrenia and severe mental illness, it's even a heavier weight, because there's so many things stacked up against this community for getting the access to the treatment and the care that they deserve.
So this policy of 9 years for pills, 13 years for biologics, I think I've read recently a few stats, 70% reduction in investments in pills, small molecule, tenfold increase in large molecule products, 24 different research projects at large manufacturing companies shelved. Greg Murphy, I know you recently had an event with him, has a bill. It's called the EPIC Act. Explain what that does.
Well, potentially it smooths out the 9 to 13. So those 4 years get evened out. What that really means, we believe, is so there's something along the lines of 35 clinical trials that are taking place in mid and late stage for schizophrenia. Um, we want that number to be as robust as possible because up until in the last year, there really hasn't been any innovation in new. There's been development for sure, but in terms of approvals, there's been too few and it's taken too long. So anything that we can do to incentivize and encourage drug makers, manufacturers to stay in the space, to learn the realities of schizophrenia so that we can create better treatment approaches. This is not a rare disease. This is something that affects approximately 1.2%. So I live in the Virginia area. So if you look at DC, Maryland, and Virginia all combined, we're talking close to 100,000 people who are living with schizophrenia. And if you add in their caregivers, right, let's say that's 250,000 people and all their loved ones, we're talking close to 1 million people on a daily basis who do not have access to the right treatments that work. We want as many individuals, clinicians, manufacturers in the space for development as we can possibly get.
That EPIC Act just equalizes the length of time. So there's no incentive to go to one category versus the other. I echo your comments. CAHC is a strong supporter of the EPIC Act. I think about, across all mental illnesses, mental health issues, 60 million people. And a lot of them would benefit from recovery, therapy, community group support, etc. But a lot of them need innovation in medicine in order to get better. And so that's why I think that this policy really needs to be fixed now, so that the investment goes into those small molecule products that can cross that blood-brain barrier, best treat these patients.
Yeah, and thank you for the chance to talk specifically about what this impact is to our community. For more information, you can visit our website. It's sczaction.org. We also have a companion organization called the Schizophrenia Policy Action Network. And our whole intention between the two organizations is to provide education, research, care, and policy advocacy to change the entire treatment system that exists for our community.
And of course, you can also visit CAHC.net to learn more about the pill penalty and its impact on investment and innovation in this space. We believe the EPIC Act is the right approach. We want to see that added to the budget bill that's moving through Congress right now. So go to house.gov or senate.gov, get in touch with your congressman or senator, tell them we need EPIC included in the budget bill. And I will see you on the next conversation with CAHC. Thanks so much.